Hey guys, welcome back. My name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City, also working with patients all over the states and all over the world via Zoom. And if this is your first time or your 100th time watching one of these videos, please don't forget to subscribe to our YouTube channel. Also, if you like the video, don't forget to like it, and also feel free to leave any comments or questions you have in the comment section. So today we're going to talk all about lactation and breastfeeding from a naturopathic perspective. So let's dive right on in. So some of the basics behind breastfeeding. So one of the things when it comes to breastfeeding is that it actually comes in stages. So initially, actually even before giving birth, many pregnant people will start producing colostrum, and colostrum is kind of like what we would consider sort of like a pre-milk, and it serves as the nourishment for newborn babies in those first few days of life. Now, colostrum it's very concentrated and very small amounts. Then, after a few days, colostrum then transitions over to milk production, and that's when people will say that the milk came in, and this typically is about 2 to 3 days after birth, but for some people that it could be a longer process. Now, when we're also thinking about breastfeeding or chest feeding, in the beginning, it is very much driven by hormones, but over time, these hormones decrease, and the amount that we produce is based on what is being removed, whether it's via a pump or via our baby. And so those are the two kind of separate systems. And this is kind of when I talking about some of the issues that someone might have with breastfeeding and supply, those are two variables of that equation. So what are some tips? Like, what are some lactation tips? So I would say like my number one biggest tip when it comes to breastfeeding is actually taking care of yourself, meaning making sure that you are well nourished, that you are hydrated, and are getting the rest that you need. Now, the rest part might sound a little bit challenging, specifically when taking care of a newborn with very strange sleep schedules, but really putting a big emphasis on those three things. And if you're not able to give it to yourself, it's also a great time to reach out to family members and friends and get the support you need so that you're really taking care of yourself so that you can nourish your baby. Skin to skin. So skin to skin contact, so that's basically taking your baby to your chest or to another part of your body. Having skin to skin contact really helps with lactation. It's all about the latch. So what are we talking about latch? This is basically the baby's ability to latch onto the nipple in a position that is going to make them the most efficient in removing milk. Now, one of the things when it comes to lactation in general, breastfeeding, that it's a skill. So it's a skill that both you're learning as well as your baby's learning. And so what are some characteristics of a really good latch that's going to really that's going to be very efficient in removing milk is basically that the whole nipple should be in the mouth, which will allow a coordination between the tongue to be free and to coordinate a movement with the lip for very efficient removal of milk. When in doubt, it is a good idea to work with a lactation consultant. Many hospitals now do have lactation consultants on board that can really assess and make sure that your baby has a very efficient, effective latch. Choosing a quiet location. So this is both whether, again, you're choosing to nurse or if you're choosing to pump, but choosing a location in your home that you feel comfortable, you are relaxed, your baby is relaxed. It's just going to really help with bringing really good results. And even again, with the pumping, having a place that you really enjoy being in can help, because one of the barriers often to efficient breastfeeding is stress and not feeling relaxed. We really need to make sure that the parasympathetic system is engaged as much as possible. Nursing on demand. This is particularly really important in the beginning. And again, as I mentioned earlier, is that first, lactation is very much a hormone driven, but very soon it becomes a demand-based driven system. And so by feeding on demand, it's just going to make that stronger, and it's just going to give you better results, specifically in the long term, with helping to increase supply. Then lastly, in this, the tips I would say is go for empty. So really allowing, either whether again you're pumping or you're nursing, really allowing your baby to really fully drain, ideally both breasts, and that's going to really help with increasing, again, supply, because again, it's very much a supply based system. So now, one of the things, of course, like as a naturopath, I'm always talking about nourishment and diet. And so what is like the optimal breastfeeding diet? So kind of similar to what I would actually recommend during pregnancy. So during breastfeeding is actually a very calorically or energy demanding activity. So you will most likely need an additional 300 to 450 calories per day. That doesn't necessarily mean that you should be like eating cake and ice cream and chips. I mean, definitely want to make sure that you're choosing quality foods. And so what are some of the main qualities? Protein. So typically we would recommend about 3 servings of protein a day. I always think it's just a good idea to vary proteins. So eggs and poultry, vegetarian sources from beans and lentils. So getting a wide variety of proteins, because that's also going to give you a different set of vitamins and minerals, more variety that you're getting. Lots and lots of vegetables. I usually will recommend, kind of, again, this is very similar to what I recommend during pregnancy, but about 4 servings of vegetables a day for really good antioxidants and vitamins and minerals. And then really importantly is hydration. And one of my favorite ways personally to hydrate with nursing is coconut water. Specifically when I'm pumping, I usually will finish my pumping session with about 8 to 16 ounces of coconut water, mostly because it has electrolytes, sodium and potassium, very similar to what we find in our cells. Some foods that you might even want to add, just because they've been either anecdotally or even proven to increase supply, foods like oatmeal and barley. Barley actually has gluten in it, so if you're gluten sensitive, obviously that's not an option. Almond and sesame seeds. So these are some foods that have been kind of shown to help improve or increase supply. You know, one thing you might also be wondering, do I need to dump and pump? And what are we talking about there, or pump and dump, is alcohol. So the interesting thing about alcohol and breastfeeding is that the amount that we ingest of alcohol and how much is actually gets into our breast milk is basically a similar kind of like similar to like our blood alcohol content. And so the amount that actually ends up reaching the infant is actually very, very low. And so some studies, specifically, you know, having 1 or 2 drinks doesn't necessarily have any adverse effects on the infant, but taking care of an infant while impaired by having alcohol is definitely not recommended. And so overall, and even just having higher levels of alcohol, typically we usually recommend that women shouldn't be having more than one drink daily. So if you're having more than that, that's not really going to be any health benefit. But as far as actually getting into the milk and the amount that actually reaches the baby is actually quite minimal. So what are some of the common problems that one might face when it comes to breastfeeding? So probably the number 1 problem is low supply. And just as any good naturopath would want to know is, why the low supply? So as I mentioned before, there's a hormone specifically in the beginning, and then the second part is much more on the demand and how much our baby is actually requiring. So if we're thinking about some of the main causes of low supply, so the first one definitely being infrequent or ineffective removal of milk. Now, whether that is that your baby doesn't have a great latch, whether tongue tie is an issue, or again, like not getting in a good rhythm, maybe there's some logistical problems. So that's the first thing that we definitely would want to consider. The next, which is something I'm always interested in more in, is hormonal issues. So certain conditions can actually have an effect on how much milk you will be able to produce. So polycystic ovarian syndrome, also known as PCOS, any of your insulin resistant syndromes also can have, which PCOS is, but other syndromes as well that have an insulin piece can have an effect on lactation. And then thyroids, with hypothyroidism, and I've seen very frequent in my practice women developing hypothyroidism postpartum. Often it definitely has to do with nutrient imbalances, but definitely an underactive thyroid can really have an effect on our milk supply. And then anatomical issues with the breast. So some of the ways that we can work around and to help increase supply, definitely, again, like as with the first one of not being frequent enough nursing, so increasing nursing. Some people will find that pumping after nursing also helps to increase supply, again, like thinking about that demand. The other thing you also want to be aware of, again, like certain things to eliminate that might be affecting your supply. So certain foods actually can lower supply, things like soy, sage, parsley, peppermint, and then some of our over-the-counter medications, things like sedating histamines, aka Benadryl, and pseudoephedrine. So these kinds of medications can definitely have an effect on supply. And as far as other ways to, besides focusing on increasing the time that you're lactating, also again focusing on proper nutrition, certain herbs can be very effective in helping to increase supply. Things like goat's rue, fenugreek, and fennel. Sore nipples. That's a big complaint when it comes to breastfeeding. And firstly, it's very normal, specifically in the beginning. And so in the beginning, having painful nipples is very common. After that, then we might want to be looking at some other factors. So initially, one of the best kind of treatments really for sore nipples is actually breast milk. So after each feed, rubbing a little of the excess breast milk onto the nipples and just allowing that to dry can be sufficient enough. Of course, there are a lot of products on the market either containing lanolin, which is animal derived, so that is not something that you're interested in. You can also look for products with calendula, cocoa butter. These can be really good for helping. Coconut oil. Now, if beyond the first few weeks you're still having painful sore nipples, a couple things that we also want to think about is correct position and latch, so that those could be an issue. The other would be very aggressive pumping or pump trauma. One of the things that often when we buy a pump, it comes with very standard, they look like little funnels. You might be wanting either a gauge that's larger or smaller than what has come with the pump, and so you want to make sure that you're fitted correctly to reduce pump trauma. And those are some of the things that have definitely been a big factor. The other problem that some people might experience with breastfeeding is clogged ducts. Again, a lot of this has to do with the frequency in which one is feeding. So again, you might want to be increasing the feeding. And so what is clogged ducts? This is painful, red, but without fever. And I'll talk about another condition that is associated with fever. And so some things that you can be doing, one definitely preventative, is making sure that you are feeding often enough. The other is doing massage, either hot or hot with hot compresses. You can also do cooling compresses. Another kind of like it's like folk medicine, using cabbage leaves, like cold cabbage leaves, onto the breast. This can all help to relieve it, but probably the number one thing is, you know, staying hydrated and make sure that you again are nursing frequently enough and really draining when you do feed. Mastitis. So mastitis is kind of similar to the clogged ducts, but even worse. So anything that ends in itis means swelling or infection. So it's basically infection of the breast. And it, besides having the pain and the redness and the swelling, it is often accompanied by fever, and more often than not will require antibiotics. So it's really important to try to prevent it. And so the big things are, again, like fully draining the breast with the feeding and making sure that you're feeding enough. This also kind of goes back to like the self-care piece. So making sure that you're eating well, that your immune system is robust, you're sleeping well, or resting well. I like saying resting well because I think sometimes like saying sleep, it's just too much pressure during this time period. The other things that you can also be doing, so unfortunately a lot of the immune supportive herbs I often recommend are contraindicated during lactation, so I'm a little bit hesitant to recommend those other than echinacea. You can also be, you know, boosting up your vitamin C and zinc without a problem. But the other important part with this is also making sure that you continue breastfeeding even during mastitis. And actually mastitis is not going to be detrimental to your baby, but actually slowing down the nursing will be detrimental to you. So what are some of the supplements that I recommend during breastfeeding? And all these, if you haven't yet created an account on my FullScript, I highly recommend that you do. FullScript, you'll get 10% off your first order of physician grade supplements. So firstly, a really good quality multivitamin. So even though you're like, oh, I'm no longer pregnant, why do I need to be on a prenatal? Why do I need a multivitamin? This kind of almost goes back to the whole thing I was talking about before, how thyroid function has an impact on lactation. Well, guess what? When we're breastfeeding, our babies are basically nutrient vampires. So being on a really good high quality multi, I personally like and take myself. I take Fem1 by Metabolic Maintenance. It seems to have the perfect balance of nutrients. Also want to make sure that you're on a good quality omega. I'll be talking more about postpartum depression, but this is going to be both benefiting your mental health, but also your baby's mental health. So choosing one that's very high in DHA. I personally like Pharmax's DHA Ultra. If you have a hard time with liquid, another one that is very good is Nordic Naturals Ultimate Omega, which you can just take 2 capsules. Vitamin D. So some people will recommend to supplement your baby with vitamin D, but as long as you're getting a minimum of 4,000 IUs daily yourself, that's actually sufficient enough to give to your baby. Some patients will require even more than that based on what your vitamin D status, but typically 4,000 IUs is sufficient. There's 2,000 IUs in the Fem1, so if you are taking the Fem1, you only need an additional 2,000 IUs of vitamin D. And then lastly, if you are having a problem with supply and you're doing all the right stuff, you're feeding frequently, you're eating well, still very low, and we've ruled out hypothyroidism, we've ruled out PCOS, there's a product that I really like by Vitanica. I really like their lactation blend. It includes all the big herbs for lactation. We also call these galactagogues. So goat's rue, fenugreek, and fennel. And often I'll actually start dosing it to a patient towards the end of their 3rd trimester if they know that they had difficulty lactating with a prior pregnancy. So I will often recommend it during the third trimester for those individuals. So I know that was a lot, and I'm hoping that you gained something from some of my breastfeeding and lactation tips. And if you liked this video, don't forget to like it. And of course, you can always pop a question in the comment section. I'm also going to make sure that I included all the links to the supplements that I recommended if you want to start those today by creating a Fullscript account. And of course, don't forget to subscribe to my YouTube channel. So there we go. Looking forward to seeing you next time. Have a great day.